Why do varices still rebleed after portosystemic shunt? Imagine trying to fix a leak in a garden hose by diverting some water flow away from the problem area. Even if you redirect the water, the leak might still happen if the pressure isn't fully relieved or if new leaks develop. That's similar to what happens with variceal bleeding after a portosystemic shunt. These procedures are designed to lower the pressure in the portal vein, which is the main vessel carrying blood from the intestines to the liver. By creating a bypass, either surgically or through less invasive methods like transjugular intrahepatic portosystemic shunt procedures, doctors aim to reduce the high pressure that causes varices to form and bleed. But sometimes, bleeding still occurs, and there are a few reasons why. First, the shunt might not lower the portal pressure enough. In some cases, the pressure gradient remains high enough to cause varices to rupture again. This can happen if the shunt isn't large enough or if it doesn't function properly. Over time, shunts can develop narrowing or become blocked, a process called stenosis or occlusion. When this happens, blood flow is restricted, and portal hypertension can return, increasing the risk of bleeding once more. Another factor is that even after a shunt is placed, new collateral vessels can develop or existing varices can enlarge. Liver disease, especially cirrhosis, often continues to progress despite treatment. As the liver becomes more scarred, blood flow through the liver is further impaired, which can cause the formation of new varices or the growth of existing ones in different locations. This means that even if the original varices were treated or reduced, new ones can appear, leading to recurrent bleeding. The severity and ongoing progression of liver disease play a big role too. Advanced cirrhosis affects how the liver manages blood flow and pressure. As the disease worsens, portal hypertension can become more severe, making it harder for a shunt to fully control the pressure. This ongoing increase in pressure can cause varices to re-rupture despite prior interventions. It's also important to recognize that bleeding may not always come from esophageal varices. Other sources like gastric varices, portal hypertensive gastropathy, or other abnormal blood vessels can bleed and might not be fully addressed by the shunt. Sometimes, bleeding episodes are mistakenly attributed to varices when the actual source is different, which complicates management. While transjugular intrahepatic portosystemic shunt procedures are quite effective in reducing rebleeding, they are not without limitations. They carry risks such as hepatic encephalopathy, which is a decline in brain function due to toxins building up because blood bypasses the liver. Also, these procedures do not improve overall survival for all patients, especially if the underlying liver disease continues to worsen. Some patients cannot undergo these procedures due to complications or poor liver function, which limits options. Lastly, gastrointestinal bleeding can sometimes be caused by other issues like ulcers or erosive gastritis, which are unrelated to varices. This means that even after shunt placement, bleeding might still happen from these other sources, making it seem like the varices have rebled when in fact the cause is different. In the context of liver health and liver cancer, managing portal hypertension is complex. Shunts are valuable tools but are not cures for the underlying disease. Ongoing monitoring, medications like beta blockers, and endoscopic treatments are often needed alongside shunt procedures to keep bleeding risks as low as possible. It's important to remember that each patient's situation is unique, and treatment plans should be tailored to their specific needs. If you or someone you know is dealing with portal hypertension or varices, always consult with a healthcare professional to explore the best options for managing the condition safely and effectively.